Welcome to our 5 on 5. We're pleased to welcome Hillary Handelsman, a certified nurse midwife and women's health nurse practitioner with Clinica's Women's Health Center. Hillary, thanks for coming in. Good to see you.
Thank you. Thank you, Craig.
All right, so tell us, a lot of us, of course, around the area know Clinica. Tell us about the Women's Health Center. What is it and how does it work?
So the Women's Health Center is our facility, the La Clinica facility that provides the majority of our women's health care, but we also offer a wide variety of services like birth control, contraception, infertility services, prenatal care, postpartum care, and of course we deliver babies.
Okay, yeah, and part of that, you're a certified nurse midwife. Tell us, what kind of credential is that? Explain that to us.
So a certified nurse midwife is the kind of nurse practitioner that specializes in normal pregnancies, healthy deliveries, which the majority of pregnancies are. And in the Valley, we tend to also manage quite a bit of high risk because we have really amazing relationships and collaboration with the OB backup doctors that support our practice and support us in the hospital. So we're able to manage a wide variety of complications in pregnancy. But we're sort of the best of both worlds, of people who are looking for a midwife to deliver their baby, but are also wanting the safety of a hospital setting. And we're the one option in Southern Oregon to be both things.
Yeah, that's a unique thing, the way you guys handle prenatal care is, right?
Right. And we have a really special prenatal care program that we offer at La Clinica right now called Centering Pregnancy, where of course you can opt to do traditional care where we would just meet one-on-one in an exam room, but we offer a special program that's nationwide, but we're the only site in Southern Oregon that has centering, which is prenatal care more or less in a small group. So there may be 8 families doing prenatal care together that will all deliver together and then have a community built in once they have their baby. So we learn together as well as doing the prenatal care practice, and it's really exciting because it's building community and education into prenatal care.
Okay, and so how do you guys, the Women's Health Center, how do you guys do things? I mean, you keep costs low, do you not?
Right, and cost is always an issue because we serve insured people and uninsured people, and we're helping people to get insurance every day. And for people who aren't able to get insurance, we have an amazing sliding scale program. So sometimes healthcare costs can be prohibitive for people for services like infertility, for example. That's a cost that's rarely covered by insurance, and it's really out of reach. It's so expensive to receive infertility services, but at La Clinica we offer that on our sliding scale. So even insured people who couldn't afford it in many of the fertility practices in the Valley can afford it here with us. And that's a really big deal.
Wow, okay, very cool. All right, well, we're going to take a quick break. We'll have much more with Hillary in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Hillary Handelsman, a certified nurse midwife and women's health nurse practitioner at La Clinica's Women's Health Center. Hillary, what's the difference between a home birth midwife and a midwife like yourself?
Yeah, so we are nurse practitioners, and I think that makes us more a part of the mainstream medical community. So we have official OB backup in everything that we do, and that's a big difference. In a home birth, if there's an emergency or a crisis, you just go into, you're like a walk-in, almost like going into an emergency room. Even though you may be able to access the birth center directly, there's no transport arrangements in place to make safe care possible. Wow. And so delivering in a hospital, but having a midwife really is an important differentiation for people who are looking for that assurance of that kind of safety. And home birth midwives can manage a lot of complications at home, but in the case that you need a transport or you need a surgery or you need a NICU, you really need to be in a facility where you can be managed that way. And so we provide the best of both worlds in that care setting.
Okay. Now, what are the benefits of going through a prenatal program like centering you were talking about earlier?
It's so exciting. And centering has had a lot of research. There's a Centering Healthcare Institute, and centering's done in 48 of the 50 states, at least. It may be more now. But it's everywhere, and part of the reason it's becoming so widespread is because it is so healthy for people. There actually are health benefits to being a part of a group during your prenatal care, like reduced stress. And the outcomes come out in reduced incidence of preterm birth.
Wow.
And that's a really big deal. So the March of Dimes, which is the preterm birth prevention society, more or less, they're big supporters of centering because there's very few things that we know can reduce a baby's risk of being born too early. And for families that ever have experienced that, you know how devastating and challenging that can be. But having support during your prenatal care experience in a program like centering is one thing that you can actually do.
Very good. Hillary, great to meet you.
Oh,
Thanks for
thank
coming.
you,
I appreciate
Craig.
it.
Appreciate
My pleasure.
it.
All right, stay with us. We'll be right back.